Hello friends, welcome back to the Zone of Med, and today we are going to discuss how to study anatomy, and we are not going to discuss any anatomy part or any anatomy topic. Today we are going to discuss how to make anatomy easy and understandable. So moving forward, first of all, we need to know from where have to start studying our anatomy portion. We have so vast syllabus of anatomy. It is divided into three parts, that is histology, embryology, then osteology. So we all get confused from where to start and what to study and how to study. So the question from where to start. First of all, I'm talking about the osteology, then we'll see about embryology, and then finally histology. So for osteology, the trick which I always use and that makes me make or that build my interest more towards anatomy is that first of all, before starting any part or any region, for example, we have upper extremity. So for upper extremity, just open your textbook and just flip the pages. When you are flipping the pages, take a piece of a paper and write the heading bones. Since you are just making your base part, no need to make a standard notes, just write the bones. All the names of the bone which you see in that particular extremity, write it down on a piece of a paper. Once you're done with that, again flip the pages and write all the names of the muscles which you are seeing in that particular content. Once you have done with that, at the last of the chapter or at the between, you get some deformities associated with that part. No need to write the muscles injured or the nerve injured, just write the deformity names. Once you are done with that, you completed 30% of your base. How? Since you know the muscles, you know the deformities, you know the bones associated with particular region. After done with this, make sure this complete part. You need to invest only 30 minutes and not more than that in this part. Once you are done with this part 1, let's move to part 2. When we move to the part 2, now we have very clear what bones, what muscles, what deformities are associated with the region. Now, open the YouTube, or if you are doing before one day of your session of a particular region, you can correlate with them in a class also. But if you are not taking any classes, open the YouTube. On YouTube, you get many tutorials on particular topic. Whatever you like, just open that part. And now make sure whenever you open your YouTube or you are studying or you are taking class, make sure you have pen, paper and your textbook with you. Once you start with the YouTube tutorial, make sure you have a book open with you, and if the book is open in front of you, start your tutorial. For example, I'm taking upper extremities. In upper extremities, we are starting with clavicle part normally. So if on a YouTube there is 15 minutes or 20 minutes tutorial on clavicle, just open that content of a clavicle in your textbook, and whatever the YouTuber or the teacher is telling about you on that particular topic, try to correlate from that. For example, if the teacher is telling you the muscles associated with clavicle, so you have already book open in front of you, so just try to correlate whatever he or she is saying. Once you have done with that, no need to mark MCQ point or no need to mark in or underline anything on the book at this point. Once you have done with clavicle, go on the Google, put MCQs related to the clavicle, and you get few MCQs over it. No matter you score less, no matter you fail on that, just try to go through each and every line of that as well as the options in that. Once you're done with that, now again open your textbook, read this. The third part is a deep reading. just started deep reading it. Once you deep read it, try to make notes and try to correlate with the things that are coming when you open your MCQ part. This makes you better understanding from where the questions are coming, how the questions are coming, and how the things are related. Since you have already write all the muscles name and bones name, it is very easy for you to memorize what muscles are associated with clavicle, what muscles are associated with scapula, and so on, the radial, ulnar, and so on. So this makes you make your mind to work more effectively. Similarly, you can go for scapula, for your radial or radius and ulnar and everything. Once you are done with this, then started with your deformity part. Once you're done with this, for example, in upper extremities, we are going to study about the plexus, brachial plexus. So once you have done with this complete basic thing, then go for your nerve supplies, innervations that make you give a deep understanding. But make sure you have two books mandatory open with you. One is your textbook and second is your Netter's Atlas. Why Netter's Atlas? Because in that you get a diagrammatic view, and diagrams can easy to understand rather when we go for the text, So to understand from the text get few difficulties, but when you grab things from the picture, it will be last for a longer period of time. So I'd suggest you, when you open your YouTube tutorial, make sure your both the boxes are open, and then you can continue like this. Similarly for embryology, and whatever I have said or I give you a trick for osteology, similar goes with the embryology part also. So once you have done with this complete, you have completed your all the basic, you have gone through each and every detail of that topic. Now go to YouTube again and YouTube, no, sorry, go to the Google and just type it important MCQs on upper extremities. This time you get a mixture of the MCQs, and in that mixture try to solve each and every questions, and wherever you get it wrong, just try to correct it by yourself by seeing on Google or books or any sources you wanted. For the histology part, since in histology we have many slides and that are tricky. So similarly pattern you can go first, but in histology, before starting with theory part, you can go first for the diagrams. Just see the diagrams, its headings, its subheadings, before starting the chapter. Once you are done with headings, diagram of the histology, then try to, third point is you go to YouTube, understand that topic, come back, read your textbook, make small notes, and then again go to your textbook, see the slides, you get a better understanding of that topic. Make sure whenever you are studying osteology part, in osteology part you get the bones, in which you can include your muscle deformities. For example, in the clavicle we take, to complete this clavicle part, make sure you take 1 hour or hardly 1 or 2 hours, not more than this. This makes you get a clear understanding of the topic. Even in examination, whenever you see some picture or MCQ related to that topic, you can make a blind case. When we talk about the cadaveric images, and people are saying that it is very difficult to identify the cadaveric images, but make sure once you have grabbed the picture or a diagram from the netters, then no one will let you stop in identifying the cadaveric images. Because in exam, if you notice, teacher gave you the muscle associated with particular region. For example, if someone is giving you a shoulder part, on shoulder you get a deltoid muscle and not the trapezius or your latissimus dorsi, right? So try to interpret things on the region wise. Do not grab or do ratification. Try to correlate things that makes your understanding very clear. So before starting any tutorials or any class lectures, make sure you open your textbook, write it down, First, all the headings, the subheadings, the bones, the muscles, and no deep reading for the first time. This clear your basic. I hope you enjoy this video and you get some tricks to learn or make the anatomy more easy and fascinating. If you get any benefit from this video, do let me know in the comment section. So guys, that is for the trick on anatomy. Soon I'm going to post it for biochemistry and similarly for the physiology. If you like the content, do subscribe, share and like amongst your friends. Till then, bye and take care.